there's not really like an underlying disease process that is making that condition worse and worse. In fact, the prognosis is actually good if you kind of push out the timeline. What do you think, based on the cases you've seen and maybe talking to your colleagues and, your mechanistic understanding of these cells, do you think they would have anything to offer in accelerating healing for those types of conditions?
100%. I think what you're talking about is actually a very good moment to act and kind of a sweet spot for healing. What's going on with a lot of these conditions is neuroinflammation, and really neuroinflammation due to cellular exhaustion. So with what you do is really wonderful, working people off of some of these medications that over time are putting either cells in a state of overworking or some sort of stress to where they're worn out. When cells are worn out, they can either enter a state of senescence. Senescence, people have probably heard of as essentially a zombie-like state. They can actually fail and undergo apoptosis, which is when a cell dies. Or sometimes they're kind of on the edge. They're just still very, very exhausted, but they're still salvageable. This is where something like Muse cells could come in handy because these cells, their mitochondria, which is the powerhouse, as people may know, it's overworked and they just need resources. One thing stem cells are incredible at is they can get to that area and they can donate things that are needed.